Cyanides are fast-acting poisons that can be lethal. Cyanides are used in pesticides and fumigants, plastics, electroplating, photographic developing, and mining. Cyanide exposure can happen in many ways, like inhalation, ingestion, and industrial exposure. Once a person is exposed, immediate signs and symptoms will be seen.
The general signs and symptoms of cyanide poisoning includes general weakness, headache, nausea, vomiting, coma, seizures, shortness of breath associated with chest pain, apnea, vertigo, then abdominal pain. The severe toxicity of cyanide poisoning may show signs and symptoms of hyperapnea, hypertensive within 15 seconds after inhalation, convulsions in 30 to 45 seconds, loss of consciousness in 30 seconds, respiratory arrest within 3 to 5 minutes, bradycardia, hypotension, and cardiac arrest within 3 to 5 minutes of exposure.
First aid treatment for cyanide poisoning. In all cases of cyanide exposure, he should be taken to the nearest hospital or medical facility for assessment and monitoring by a registered medical practitioner. Speed is essential. For inhalation, remove patient from exposure, keep warm and at rest. Oxygen should be administered. If breath has ceased, apply artificial respiration. Using oxygen and suitable mechanical devices such as a bag or mask. Do not use mouth-to-mouth resuscitation. For skin contact, remove all contaminated clothing immediately. Wash the skin with plenty of water. Treat the patient as for inhalation. And the other one is eye contact. In eye contact, immediately irrigate with water for at least 10 minutes. Treat patient as for inhalation. Last one is ingestion. Do not give anything by mouth.
Administration of oxygen and artificial respiration. This is the most useful initial treatment for cyanide poisoning. This means where cyanides are used, at least one person should be trained to administer oxygen. If breathing has stopped, artificial respiration is essential. In the past, safety data sheets have advised that mouth-to-mouth resuscitation should not be used because of the possible risk of secondary poisoning to the first aider.
I would like to explain about antidotes. Several antidotes can be used to treat cyanide poisoning. A brief description of some of the most commonly used antidotes is given. Due to the potential for serious side effects if administered incorrectly, antidotes should only be injected by or under the direction of a registered medical practitioner. The prescribing of information should be kept with the antidotes. The following antidotes are most commonly used: sodium nitrate, sodium thiosulfate, dicobalt acetate, hydroxycobalamin.
The person works in a photographic studio. He develops pictures for almost 5 hours in his dark room. When he inhales the fumes, he feels nauseated and dizzy. About 8 minutes after he arrived in the hospital, he developed slurred speech and then fainted. When the patient arrived at the hospital, the doctor noticed that the patient was hyperventilating, though his skin was very much cherry red in color. Upon insertion of an endotracheal tube, a bitter almond odor of his breath was noted. After physical examination, it was revealed that the patient was bradycardic and hypotensive.
As the patient used to work in photography department, he may have been poisoned with cyanide. In photography, sometimes potassium cyanide is used for the fixing agent because it is superior as compared to other types of fixing agent. In this potassium cyanide is used for wet plate collodion. This potassium cyanide, when comes in contact with acid, forms hydrogen cyanide, and which is gaseous in nature, and this gaseous hydrogen cyanide can easily be inhaled into the lungs. Hence, this case can be considered as a cyanide poison. The common forms of cyanide are hydrogen cyanide, potassium cyanide, and sodium cyanide. All of these forms of cyanide have the characteristic property of bitter almond smell. The aqueous solution of sodium and potassium cyanide, both of them are alkaline in nature. The potassium cyanide can form gaseous hydrogen cyanide when it reacts with acids or even acid salts. The boiling point of hydrogen cyanide is about 25.70. Hydrogen cyanide is soluble in ethanol and is miscible with water at 30 degrees centigrade. Sodium cyanide is white hygroscopic crystalline powder. On the other hand, potassium cyanide is white deliquescent solid.
So, here's what happens. Cyanide is dissolved in the bloodstream and carried to the body cells. It has an affinity for cytochromes, which are mitochondrial enzymes for energy production, to cellular level. Cyanide interrupts the energy transport indirectly at cellular level by attaching to the cytochrome, blocking the cell's activity to use oxygen to produce energy. The oxygen remains in blood as oxyhemoglobin. So, how do the antidotes act to remove the cyanide? The nitrite from amyl nitrite converts hemoglobin to methemoglobin. Methemoglobin has a strong affinity to cyanide and will extract cyanide from the cytochrome. However, methemoglobin cannot bond with oxygen, so there must be a balance in the blood between hemoglobin and methemoglobin in order to supply oxygen to the cells versus removing cyanide from the cells. Medical literature recommend methemoglobin levels be less than 30% of the total to prevent adverse cell effects. Too much methemoglobin is called methemoglobinemia. Patients has positive response to the first dose of nitrites and rarely develop methemoglobin levels above 25%. Sodium thiosulfate provides additional cyanide detoxification, does not directly act with cytochromes, instead works with rhodonase to convert cyanide to thiocyanate, which is much less toxic with cyanide and is naturally eliminated in the urine.
Inside our cells, organelles called mitochondria converts the energy stored in food to a form that the cell could use. A group of proteins on the mitochondrial membrane forms the electron transport chain. Carrier molecules donates electrons from the food to the chain. As the electrons flow, the chain pumps protons to the membrane. These protons move back across the membrane to the protein ATP synthase, causing it to spin and make the cell energy source ATP. When cyanide is ingested or inhaled, it inhibits the protein cytochrome C oxidase. This backs up the whole chain. ATP production stops. Within minutes, cell death could occur.
Cyanosis is a blood discoloration of the skin, resulting from poor circulation and inadequate oxygenation of the blood.
The patient did not appear to be cyanotic even if he was gasping for a breath, because during cyanide poisoning, cyanide prevents the use of oxygen by the cell but does not affect the amount of oxygen in the blood. The cyanide binds to the cytochrome in electron transport chain, blocking its activity. Without electron transport, mitochondria cannot generate ATP and the cell dies. The blood remains oxygenated since the oxygen is not used. Thus, the patient did not appear to be cyanotic. This is your electron transport chain. In the electron transport chain, the complex 1 receives electrons from the Krebs cycle and then pass on the electron to the coenzyme Q, which is then passed on to complex 3 and then passed on to complex 4. During amobarbital overdose, amobarbital inhibits complex 1 from receiving electrons from the Krebs cycle. Thus, no electrons are transferred from complex 1 to coenzyme Q. But complex 2 is still able to receive electrons from FADH and transport it to the electron transport chain. But the energy produced due to the electron transport is very little. During cyanide poisoning, cyanide attaches itself to the complex 4, which is cytochrome oxidase. Due to the attachment of cyanide to the complex 4 is in reduced state. Thus, it cannot receive an electron. As the complex 4 cannot receive an electron, the complex 3 cannot pass electron to complex 4. Thus, it is also reduced. As complex 3 is in reduced state, it cannot gain more electron, which in turn inhibit complex 1 and complex 2 from transferring electron. Thus, the whole electron transport chain stops and the cell dies. Due to this, cyanide poisoning is more rapid and fatal than amobarbital overdose.